Greetings. This is Dr. Michelle Brown-Echerd, naturopathic doctor, naturopathic physician in some states. You might recognize me from my personal channel, but this will be a video for my clinic, Tower of Health LLC. And the purpose of my clinic, around 2009, 2010, was to transmit health to the community. So trying to get from walking outside my residence and helping people in the community that's near to people that are far and everyone in between, as far as sharing education, information, doing treatment on actual patients when I am able to, because of the laws of the country and or state. There's a very common question that comes up, not even really from potential patients or their family members, but there's that question of even from healthcare providers and other people in the community when I am a patient or community member. So what is naturopathic medicine? There's a really broad answer to that because it depends where you are, who you are, what you're doing, and what you're allowed to call yourself. So naturopathic medicine can be, in my opinion, at least with my studies, is integrative healthcare, getting to the root cause of what's causing the condition. So being able to diagnose, being able to do labs and imaging to get answers, as well as a really comprehensive medical history and past and present medical history. In some situations, and everything is always, for me, individualized treatment plan, there will be palliative measures, which in certain states in the U.S., prescriptions, antibiotics, antibiotic ear drops, eye drops, different things that you actually need a medical license to prescribe so that your patient can pick that up from the pharmacy. Are some situations for myself, not always for prescribing, but for insurance purposes, accepting insurance purposes of having an actual DEA number. And in the situation of having that actual DEA number, government plans, Medicaid. I don't know every state and province, but Medicaid will require that number, whether you utilize it to do controlled substances or not. And thinking of this toolbox or this bucket of modalities, not every naturopathic physician or naturopathic doctor has or wants to use everything that we were taught, which was super comprehensive. The more that I practice and think about my training, as I'm doing different modalities or as I'm seeing different conditions and in different age groups, I see babies all the way up to geriatric groups, I just say, oh, I'm really grateful for all we've learned. And I was one of the people that went to class every day. So going to class every day and being in class for 8 to 10 hours a day and then studying every minute after that may not have felt so fun to be stuffing a lot of knowledge and information and hands-on training into my brain. And the one good thing about community is being able to not be alone in that classroom, as long as you're in the classroom. So students that chose maybe not to, or attendance may not have been required, but you're still going to have to learn it, you're still going to have to pass your test, and you still have test upon test stacked on what you learned from day one all the way up to your graduation and then beyond. Education does not stop when you get your degree. So naturopathic medicine has a definition that I am not giving you a technical definition. There are some government definitions about only using natural products. That definition by the government needs to be updated, because why would many of us hold a DEA license to prescribe controlled substances if needed? It could be something from nature, but it's not just here is a jar of herbs from this organic farm that I'm going to have you steep into a tea, as an example. It's not giving any medical advice, just giving you an example. There is the term naturopathic physician, naturopathic doctor. There's traditional naturopath. What are the types of schools? Okay, I went to one. I went to an accredited 4-year university. I took probably 5 3/4, 5.5 years, mainly because I had done a program that had started actually as a 7 or 8-year program as a dual degree naturopathic student and Chinese medicine student. So the doctoral level was MSOM at the time. I had dropped that down to the acupuncture level, so I wasn't going to be able to do the herbs, like the individualized herbs. I would have been able to use the pre-made pills and formulas. But as wanting to have been a dual degree, I would have been able to use herbs as a naturopathic doctor, and I wanted to do naturopathic midwifery. I also wanted to do research. My medical school at the time was NCNM. It's now in UNM, Portland, Oregon. There's different programs. There's many more programs now. There's undergrad programs, but I was like, oh, I want to do naturopathic. Oh, I want to do Chinese medicine. Oh, I want to do childbirthing. Oh, I want to do research and get certificates and degrees and all those. Okay, so I chopped this to naturopathic. Let's get through that program. Challenging. Midwifery, challenging, lots of hands-on hours, thousands of hours. Someone can say, hey, I live in such and such state and I have a naturopath and they can't accept any insurance, they don't do anything, are you homeopath? Are you a holistic doctor? Well, it depends. It depends when you hire me and I'm your doctor what you need that day. Do you live in a state where I can do wound care and you need to have sutures done? Do you live in a state where I can deliver your baby and provide prenatal birth and postpartum care as well as infant care, early age infant care? It depends on the situation. Are you interested in homeopathic? Then well, you can do homeopathics and botanical medicine and supplementation. So that's a good question. The different types of schools, since I went to the accredited school, there's at least 6 in North America, and the 6 that will fall under the national boards. There's one in Portland, there's one in Seattle. The Seattle is Bastyr. That one also has a campus in San Diego. There is one in Illinois, and I'm so sorry, the 2 Canadian schools. There was one in Connecticut. I don't know what happened to that one. There's one in Arizona. I may have missed something, but there's at least 6 that we can take a national board exam. You take more than one board exam. You take supplemental board exams, depending on your state. There's the acupuncture one, and that's, I believe, only for Arizona as a attachment to the naturopathic. And then there's the pharmacology. There's the minor surgery. There's the minor surgery, so separate exams. So you go to take all this in the big comprehensive basic boards after year 2, and then after year 4, or whenever you finish, like if you're doing dual degree or having extra classes, or want to stretch out from having 36 credit hours on your schedule and shrink it down to 30 or 28, then you can do the program in the amount of time that you need to do it. Don't quote me on this because things have changed since I started school in 2009, since I had graduated 2014 with my obstetrics certificate in 2015. So you could say, hey, I never heard of a naturopath delivering a baby. Well, there's a lot of things that a lot of people didn't hear of, even though they're naturopaths. If you went to an accredited school and you went and saw a patient that said, hey, this person didn't do these certain things for me, well, are they in a state that are allowed to call themselves a doctor if they're not a doctor? If they didn't receive a doctoral level degree, did they do a correspondence course? Did they do a school that was 2, 3, 4 years long that you learned about holistic medicine and labs? I haven't gone to those schools. There's certain states that say unless you go to the accredited school and graduate from these list of schools, these lists of schools say that you can get the state license. Every state is different. There's licensed state, pre-licensed state, there's newly licensed state, there's unlicensed states, and I'm pretty sure there's one at least that you're not really able to practice at all. What happens when a naturopathic doctor is licensed in Portland, Oregon, and can deliver babies, and can prescribe, and can do minor surgery, and can see all ages, most conditions, do a lot of hands-on modalities, goes to a state somewhere where it's a registered state. Well, they, in one state, can do all of this stuff, and you can have a full-service clinic. Primary care physician in Oregon, if you want. Primary care physician. Plastered on the front of your clinic. And in this state, you can't even call yourself a doctor. You have to say that you're, I don't know, because I don't live in those states. And patients can call from these states and say, hey, I don't want to drive to your clinic. Hey, can you do telehealth? For me, no, I can't do telehealth until you come to the state and show me that you're in the state and show me that your GPS says that you're in the state line. Do some people do different things? Do some people do coaching? Yes, and I don't know a lot of those people. Do you need to have malpractice insurance to accept insurance? Yes. In most cases. What does your malpractice say? So the person that you see, you can find out what school did you go to? Did you graduate that school? There's people that graduated, got their degree, called themselves doctor because they have earned the degree, like if you earned a PhD, and they may still be working on the board exams. And they may be saying, I'm a traditional naturopath. I graduated from the school. I'm a doctor. You can look them up for their license. If you look my name up in certain states, I have a hyphenated last name. It is a little bit challenging to find. I'm also licensed in 3 states. I'm also have a certificate in natural childbirthing from Oregon. And I'm also a certified doula, which is a completely different job. I've had a lot of opposition with people saying that that's not going to be covered under my insurance. Like, I'm not delivering babies as a doula, or coming in to see people in the community and say, oh, there's that doula. Oh, doulas are very important. But I do that so that if the case of everything that I have licenses for in medicine, I'm not able to attend a birth, if somebody wants me as a support person, then I maintain that certification that I received, or at least started the doula training prior to getting my naturopathic medical license, or even before. I believe I started the doula training in 2013 as a midwifery student at NUNM, which is now in UNM. So, what is naturopathic medicine? I'm not giving you a straight Webster's definition. What happened 100 or 200 years ago when doctors were doctors, and doctors showed up and they did the medicine and they did the treatment plans and they sat bones and they helped people deliver babies. There's a big disconnect with a lot of things separating out. A lot of pharmaceuticals based on plant-based substances and mineral substances. What happened to that umbrella of let's give quality care to our patients? What happened when there's insurance? What happened when Medicare doesn't recognize a naturopathic physician as a naturopathic physician or a naturopathic doctor license? If we were chiropractors, which some naturopathic doctors that do have multiple degrees, I've seen that very common, they could take Medicare and most likely Medicaid and most likely every insurance. That is very good to give an idea of some hope for change, so that when that question is asked, my clinic can respond better instead of saying, it depends where you are, what you need done. All of the birth control measures, certain prescriptions, communicable disease prescriptions, it can be very challenging to not be able to prescribe that and have, say, women's health wait list 6-9 months long. People wait months for their appointment. It gets canceled. The providers aren't available. And then you have a doctor who in one state's a primary care physician who can do health care, who can do telehealth, who can do various types of appointments in different locations, and the clinics set up certain ways. But then you become restricted and you have people coming to you saying, hey, come into your clinic, your waiting room is empty. Are you actually a doctor? Why are you able to see me in the same week or 2 weeks or month and everyone else in town, the big places with the big parking lots, are able to see people 6, 9, 18 months. I've been a patient waited 6, 9, 18 months for care. I've been a patient waiting to get on a wait list to a facility and never got on the wait list to get on the wait list because that was so long. There's a lot of places that don't accept insurance at all, or different types of insurance that makes it cost prohibitive. So the question can be, what can many licensed naturopathic doctors do? Well, there's a huge list. You could write a book. But can you have the wisdom, the knowledge, the skills to do versus what can you do in that state with thinking of the word, are you a homeopath? Are you a holistic doctor? Are you a functional medicine doctor? To end this introduction with my opinion on the definition, functional medicine, getting the root cause. There are some naturopathic physicians that take different extra certification courses so that they can put that they have been formally trained in functional medicine. What I was taught in my medical school for 5.5 years was what I was taught, and there was not a lot of little key words attached to that whole umbrella of a profession. And so it makes it challenging for me to build confidence in a patient, saying, oh, well, you're not that. People say, hey, do you do oncology? Hey, can you deliver my baby? I could, but I can't, because where are you in this country? Where am I in this country at the time? Can you do telehealth across state lines? Oftentimes not. The insurance says that I need to be in the same state as you. So when I'm in that state, I will give you a call before I go. So there's a lot of in between, a lot of gray area. There's a lot of questions. I could take some of what I've written or what I've said and type it out and put it on my website, www.tower-of-health.com. And until next time, be well.